Everybody. Good afternoon, everyone. My name is Chris Rubisch, CHRISRUBESCH. I'm the president of the Minnesota Nurses Association. Really proud to be here with M&A members and members of AFSCME and other unions, here to continue to put pressure on the Hennepin County Board to treat these workers fairly and to keep patients at the center of what we're doing. And I'm just really proud of the work that the unions, including M&A and AFSCME, have been doing to put that pressure on the Hennepin County Board. So I'm really pleased to introduce one of our co-chairs from the Hennepin County Medical Center, Jeremy Olson-Ellert.
Good afternoon. My name is Jeremy Olson-Ellert, Jeremy Olson-Ehlert. I'm a registered nurse and M&A co-chair at Hennepin Healthcare. We're here today as we find ourselves at a pivotal moment where the very essence of our health system is being questioned. Behind the walls of statistics and reports lies the profound truth, which is the human cost of decisions made without empathy, without understanding, and without public transparency. We're here after months of inaction from hospital leadership to call on the county commissioners to use their powers outlined in the Minnesota state statutes, which state that the county board shall retain the right to dissolve the corporation, reorganize the corporation, or remove the entire corporate board in order to resume management of Hennepin County Medical Center upon a 2/3 vote of the entire county board. Our nurses continue to see workplace violence and assault levels at the highest levels. Our nurse retention rates are plummeting, and we cannot keep nurses at the bedside under these working conditions. There is no nursing shortage, just as a shortage of nurses willing to work in an unsafe working environment. Access to healthcare has also become increasingly difficult, with nurses not being able to get appointments for 8 months, even with a diagnosis of cancer. In December of 2023, the Hennepin County Commissioners passed the 2024 Hennepin Health System's budget with resolutions, one stating that the hospital board shall not increase the CEO's salary without the HHS board chair or designee first briefing the county board on any proposed adjustment. The hospital board held an emergency meeting on December 15th, going over the resolutions passed by the commissioners. The hospital board met again January 24th, 2024, in which it was announced that the hospital board would increase the CEO's salary based on a highly successful job performance. The Hennepin Healthcare System's board leadership also met with M&A HHS unit leaders to discuss certain topics, which the board leadership made clear that the commissioners have their own agenda. It appears that the hospital board, which was created to operate the corporation, has gone fully rogue and operating in a way that makes it necessary for the commissioners to use the powers given to them. As stated before, our nurses deserve better, our patients deserve better, and our community deserves better. Without accountability and change, the quality of care, workplace safety, and staff retention are at serious risk at Hennepin County Medical Center. Commissioners, we call on you to initiate the dissolution of the Hennepin Healthcare System's Board of Directors and to hold hospital leadership accountable for their actions in which are eroding the foundations of our esteemed public institution. My next colleague who will be speaking is Sarah Frank from ASP.
Hello, my name is Sarah Frank, SARAFRANCK. I am the president of AFSCME Local 2474, representing more than 1,000 workers at Hennepin Healthcare. We stand alongside our union partners and fellow co-workers at Hennepin Healthcare here today to say enough is enough, and we support the dissolution of Hennepin Healthcare's board of directors and seek to return the oversight of our hospital system back over to Hennepin County. Under this new leadership model, we can have greater transparency, better governance, and can actively work with the Hennepin County Board of Commissioners, who are elected and accountable to us as workers and as voters, to advocate for the needs and priorities we are passionate about. Our coworkers, our patients, our residents need and deserve the best quality healthcare that they can depend on, transparency and accountability throughout the healthcare system, and proper governance and oversight of our life-saving healthcare system. We are not getting any of those under the current system, and we deserve better. Time and time again, we have seen the current leadership of Hennepin Healthcare prioritize a few at the top at the expense of our workforce, our patients, and our communities. This must stop. AFSCME is proud to stand alongside our labor union allies here today, and together we will show that solidarity makes a difference for our fellow workers, our patients, and our communities who need us the most. Thank you. And I will introduce Shane from HK.
Good afternoon. My name's Shane Hallow. I'm the president of the Hennepin County Association of Paramedics and EMTs. My first name's Shane, last name's Hallow. The Hennepin Healthcare Board has completely abandoned their mission and is operating in a way that is self-serving, disregarding the needs of the patients and staff working at Hennepin Healthcare. I'll keep my comments brief, but we're joining our union allies here and calling for the dissolution of the Hennepin Healthcare Board to put the governance back under Hennepin County. Thank you.
Any questions or?
Yeah, Jerry, can you just talk a little bit about why now? Obviously, the county staff is still working through the new oversight that was approved by the board in December. I know that there's been some milestones in that, but it's not completed yet. I just wonder why make this call now at this time?
Yeah, so we've been out for several months trying to work with not only the commissioners, but with hospital leadership. We've met with the hospital board, and after numerous meetings, we just feel that we aren't being heard, we aren't being listened to. They continue to send a message that staff retention is starting to increase. However, the nursing rates are continuing to plummet. We're seeing nurses leave continuously every month, where we just continue to, it's about $80,000 to bring in a new nurse. And our retention rates for 1 year as nursing are very low and concerning. So we want to try to increase those retention rates, but also increase any chance of, the benefits that were cut last year. It's already April. We're going to already be coming up on, benefit enrollment in the next months down the road. So in order to really make a difference, since hospital leadership isn't willing to listen to us, and that the actions of the board in January to increase the CEO's salary after they were specifically spelled out not to by the commissioners, really just underscores that this board is not operating in a public, transparent way as it should be for the citizens of Hennepin County, for the state of Minnesota, and for taxpaying dollars to increase a CEO salary when they were specifically told not to.
Other questions? So one other one, and that's there's a bill in the legislature right now that would give the board the express ability to, it would require a majority to approve the budget. Are you familiar with this bill? Can you talk a little bit about the purpose of it?
Yeah, so M&A is leading that bill to allow the current state statute says that the commissioners shall approve a budget. By changing it to shall approve by majority vote, gives the commissioners a little bit more wiggle room to be able to, if this budget that's coming in front of them doesn't really meet the mission values and the residents of the county, to be able to push back and say, this isn't acceptable. You need to go back. You need to redo this budget and come again at a later date. It gives them the opportunity to be able to say no, whereas previously they weren't given that option. They were strictly told that they had to approve a budget. So by having a little bit more authority, they can be able to hopefully make more of a difference.
Any other questions? All right, thanks a lot. Thank you.